Right, welcome back. It is 10 minutes past the hour on the second hour of the show, right here on your World on Wellness Wednesday. And today, like I said, on this hour, we'll be focusing on our kidney health. And we'll be really focusing because tomorrow, that is 13th March, is World Kidney Day. And the theme for this year is very, very simple, okay? And we'll be looking at it even as we continue with conversation. But for now, we have Professor Ahmed Sokwala, who's a consultant neurologist at Aga Khan University Hospital right here in Nairobi. It's so good to see you, Doc, again. Do you want to speak to your mic?
Sure,
and
thank you very much.
The people at home? This is your camera.
All right. So, yeah, thank you much for joining us today, and you'll enjoy the episode. We're going to talk about kidneys, as you say.
Yes, absolutely. And we'll also have Tony Kimtai, who is on dialysis, also to a little bit share more of his story and his journey, really, as far as, our kidneys are concerned. So it's good to have you. Thank you so much for making the time. How are you? How are you feeling this week?
Today I'm feeling great. It's a pleasure to have me here today.
Yeah.
So I hope it's going to become a good session.
Absolutely. And with you too, yes. We'll learn so much from the conversation today. And said on 13th of March, the world actually marks World Kidney Day. And the theme for the year, that is 2025, is Your Kidneys Okay? Okay, that's the question. And it's all about detect early and protect kidney health. And can we just take a special look at kidney health right here in the country? Because this is a practice. This is what you do on a day-to-day basis. So how are we doing, say, as a country, and what are the numbers, if you have share with us as far as kidneys? Yeah.
So, thank you very much for that question, and very important question. And that's why, the International Society of Neurology with the World Kidney Day organization have come up with that topic is, are your kidneys okay? Because, kidney is a silent disease unless you check them, unless you look for, it, you detect it early and prevent the progression of kidney disease. So lots of kidney disease in the world. And if you, narrow down to Kenya, there's they say at least 10% of the population have kidney disease, okay? So it doesn't mean that 10% of the population are on dialysis, but 10% of the population have some sort of kidney disease. So let's say if you have a population of around 50 million, 5 million people have kidney disease. Unfortunately, those 5 million are, out there that don't know, okay? And that's why theme, okay? Are your kidneys okay? Detect early and prevent kidney disease. So 5 million have some sort of kidney disease, stages from 1 to 5, and we'll discuss a little more on that later on.
Yes, we can hear. But Tony, let's speak to you. So only 24. I hope it's okay for me to say your age. Do not. All right. So can we go back to your diagnosis? All right. Because you were diagnosed when you were 21. No?
I was 22.
You were 22 when you were diagnosed. So can we go back? How were you? What was happening before you actually got your diagnosis? And you want to speak closer to the mic? Yes.
So actually, I just graduated from campus.
All right.
Started hustling outside. Everything was well. I was not sick. I've never been sick. But one day I just woke up to some swollen feet.
Okay.
So I thought it was maybe because of the previous hike we had. Maybe I thought it was something with the muscles.
All right.
But like 3 days, it busted.
All right.
And I realized it was a bit puffy. I knew muscles are not puffy. So I had to go and seek medical attention.
All right.
I went to hospital. They did some tests. At first, when they tried, they realized my Bs were higher than normal.
Okay.
Which I had never known. And then did some tests. That time, at first, they said it had to do with my thyroid function. They said it's hypothyroidism that can cause that swelling of my feet.
Okay.
So I got medication for the hypertension and some diuretics for swelling. So it went away. So I dismissed it. It was just like any other disease. But now, that time it was closing to the end of the year.
All right.
So all of us were going for holidays. I went home, celebrated with my family. But on 1st, 2023, I woke up with a severe ache. I was even having a blurry vision.
Yeah.
I was vomiting a lot. I couldn't take anything, even water. It was just coming out. So I was taken to hospital. I was taken to hospital in a hospital called Mercy Hospital in Damaravin. They did some tests where they realized my creatinine were high, my urea were high, and then I was passing blood through my urine. So that's when they started to suspect I had nephrotic syndrome, which I'd never had.
Never heard of. Yeah, I can only
ask
imagine.
Doc later what that is.
Yeah.
So that time, CDK had not been put on the table yet. So we are all on nephrotic syndrome. So I was given some medication, some diuretics, so they were actually dealing with the symptoms.
But not the disease itself.
Yeah, that's the issue now.
I see.
They were dealing with the hypertension and the fluid retention and the nausea and vomiting. So after a while, I got better. I decided to, obviously, I didn't stay home forever. I had to come to Nairobi to come and
continue the hustle.
Being the firstborn son in our family, I have to come and look for money. So I came back to work. I had just recently gotten a contract at my place, which had insurance. So I wanted a second opinion. And somebody recommended Dr. Joyce Bobenge. You know, Doc knows.
Yes, I know Dr. Joyce, yes.
So I just came in. I was okay. I just came in. I wasn't feeling anything. I just came in. Then we did tests. We did some tests. And now, that is when Doc realized my kidneys started to damage.
Oh, wow.
Because these are tests done as the GFR. The number was reduced. So to confirm it, they did a biopsy. And then now that it was confirmed, I had acute kidney disease stage 3.
Wow. Can we put a pause there? Doc, do you want to pick up from what it is? So several things. Number one, swelling feet. Do you know what that was? Went to a hospital. You were told it's thyroid. Like, it's a lot of things. And you rightly said when we started the show that this is a silent disease. You might not really know. So do you want to just help us understand, first of all, why that's the swelling and what is it that we need to know about kidney disease?
Yeah, so thank you for sharing your ordeal. So, as I said, kidney disease is a silent disease. He had probably kidney disease for some time, but he didn't realize until he had swelling in the feet. Swelling in the feet means that, let me stick the functions of the kidney. One of the functions of the kidney is getting rid of water from your body. You just freely go drink as much water you want. You don't think what's going to happen to the water, and the next time you see it, it's in the washroom, paying it out. So, but people with kidney disease, they can't do that because the kidneys don't filter that water, and that water accumulates in your body. And causes swelling. It's one of the signs of kidney disease. The other sign, as you mentioned as well, is headache. Headache, when you get persistent headache, and make sure you go and check your kidneys because it could be a sign. Nausea, vomiting, that can be a sign of kidney disease, but when toxins build up in the body, that's what you feel: nausea, vomiting, itching. Those are some of signs of kidney disease. On the urine side, you probably must have noticed frothy urine. There's a lot of froth on the bowel when you pee. On the top of the bowel, there's a lot of froth or some blood in urine. So that triggers you to go and seek medical advice, get attention. So what he said is, he has nephrotic syndrome. What nephrotic syndrome means, one of the functions of the kids also, you filter 180 liters of blood every day. Your kidneys filter 180 liters. You know what 180 liters is? It's a lot of so that's the function of the kidney. But we don't pee 180 liters, do you?
No.
Yeah? You pee at maximum will be 1.5.
Yes,
yeah, so all the others is reabsorbed in the body.
Right.
So it's filtered and then reabsorbed. So the kidney is like a filter. And when people have nephrotic syndrome, I usually give this analogy, it's like a sieve.
Yeah.
Know, like
is it easier to hold?
Sure.
Yes.
Yeah. So it's like a sieve. So, like the way the tea, the chai, you pour and then you sieve it.
Yeah.
So proteins should not leak into the urine, okay? So the proteins, when it's filtered, the proteins should stay back in the body.
Okay.
What nephrotic syndrome means is that sieve of the kidney gets damaged, and now you start leaking protein in the urine. So your protein level in the body goes down.
Goes down, yes.
Okay, so your albumin is one of the tests we do, goes down, and when your albumin goes down, your capillaries start becoming leaky, and that's why you have swelling in leg, swelling in the face when you wake in the morning, and probably that's what he had, nephrotic syndrome. If it's picked up early, you do a kidney biopsy, you find out what's causing, and you treat it. This is a reversible condition.
Okay.
Yeah.
All right. How early are you talking about?
So as soon as you see, you're swelling, and you get appropriate medical attention, see a nephrologist, get a kidney biopsy, you will get the diagnosis. Unfortunately, still in this part of the world, all patients are missed out. They're treated as urine infection. They see protein in the urine, they say, oh, there might be a urine infection, just give antibiotics and let the patient go.
Okay.
But no, this is something to with, the kidney becoming leaky, and the kidney is going to get damaged.
Okay.
So just get a nephrologist's kidney doctor's opinion, get a biopsy and get appropriate treatment. So you prevent what he's suffering from now.
Yes, because lots of people don't we tend to self-diagnose about swollen feels like, oh, maybe I messed up workout yesterday and all those things, but yet you could be dealing with something that could be attended to early and fast, like you said. We literally have 2 minutes to go on a break. He mentioned acute, and we are acute kidney disease and chronic kidney disease. Are you able to do a distinction between the two very quickly before?
Yeah, of course. So acute kidney injury, what we call it, acute kidney injury, is your kidneys malfunction, or to make it easy for patients, I just tell them they go to sleep. Okay, so they don't function acutely, but once you treat the condition, and usually happens in patients who are sick, who have an infection, who are in ICU. Okay, they've got an infection, your blood sugar goes down, your kidneys don't get enough blood, or you've taken medication which will affect the kidney, or nephrotic syndrome, things like that which will affect the kidney acutely. Okay, and the small structures in the kidney, the nephrons and the tubules die off, but then they have a capability of regenerating. Okay, so acutely your kidney shuts down, might need a dialysis sessions for a couple of times, and then your kidney, once it starts regenerating, the kidney starts working again. So that's acute kidney injury. Chronic kidney disease, you have damage in the kidneys for a longer period of time. Things like high blood pressure, diabetes, glomerulonephritis are common conditions which affect kidney for a longer time. So gradually your GFR, as you mentioned, the glomerular filtration rate, which is measured by blood creatinine, you calculate the GFR, and gradually, this fibrosis, like the way you get a scar and you heal, there's gradual fibrosis of the kidney, and then, it could take a few years for it to completely die off, and then you have to dialysis for the rest of your life, or you get a kidney transplant.
All right. Okay, let's take a break and absorb all that that we've discussed on this first hour show, and then when we come back, Tony will begin with you. So you were told at the time it was acute kidney injury disease, stage 3. So we'll pick up from there, and Doc, you'll take us through understanding the different stages, but also talk about dialysis and transplant, which is something that we want to focus on the conversation. But if you have any question as far as kidney or kidney disease concerned, send them our way, and that is at TV Kenya, both on Facebook and on X, and tag me as well at Lube_Winnie. We'll forward your questions to the day. If we see them right here, we'll also be able to answer all of them. All that is coming up after the short break. right, welcome back to the show. That is Your World, 28 minutes past the hour. Time really flies, and there's so much that we need to cover on the conversations hour of the show, and that is on our kidney health. And tomorrow, that is 13th March, is World Kidney Day, and the theme for the campaign is, are your kidneys okay? Very good question over there. And so detect early and protect kidney health. And we have Professor Ahmed Sola, who's a consultant nephrologist at Aga Khan University Hospital right here in Nairobi, together with Tony Kimbe, who is a dialysis patient, really help us, put to perspective what we talk about when we say our kidneys are important, and also understanding our kidney health. So Tony, we left at a point where, so you were just receiving your diagnosis and you were told it is acute kidney disease stage 3, but it quickly progressed to stage 5. Do you want to tell us a little bit about that? And first of all, just received news that you have kidney disease and it's acute. What was that like for you?
First of all, I was really shocked because it was just walking. I was just coming for review. It's not like I was sick. I just came in. And then you walk out with the report saying I have acute kidney disease. So I'm shocked.
Yeah.
I'm not supposed to tell my parents the news. And I don't know how they're going to receive it. Well, I'm trying to be strong for everyone, but I'm still scared and shocked. But Dr. Joyce, who I was seeing by then, explained to me what was happening. When I was at 3, they said we could actually maintain it, like we could reverse it somehow.
All right.
But apparently my blood pressure was so high, so I think that was continuing to damage my kidney more.
Okay.
And then when the nephrotic syndrome, we were trying to suppress it, but it didn't really respond the way we expected. So in 3 months, it had progressed to stage 5.
In 3 months.
Yeah, I'd gained a lot of it because, I wasn't exiting fluids well. I'd gained weight to about 96. I was so big. So I had to be admitted. Now, this is when I started my first dialysis. I was put a temporary catheter to do 3 sessions to see if they can stabilize the GFR.
All right.
But unfortunately, it's just keep on racing. So now we had to opt for a permanent catheter so that I'll be doing dialysis because my body wasn't removing the urea and all those toxic stuff in my body anymore.
Okay.
So now my life has changed. I'm being told I'm supposed to be doing dialysis twice every week.
Wow.
So I'm wondering what this is. Also, I'm still trying to wrap it around my head. I am shocked. Everybody's shocked. It has gotten into me mentally. I'm frustrated. I'm worried. I'm thinking I'm even going to die because, well, with what knew back then, a chronic disease, it's in the same level with cancer and all that. So I had to be educated about it, to be told how to, walk around it. So a doc really helped me.
Okay.
Make understand. I learned about the whole case. You have to adjust.
Yes.
You are no longer
and
on your normal
how
life.
life will look like after diagnosis.
First, you can't eat what you used to eat. And people don't really get the luxury of drinking water. Renal patients, water, because your body doesn't excrete the water normally.
Yeah.
Now you have to reduce the water because it will build up in your body, will swell a lot. So now I'm supposed to reduce to at least a liter a day.
Okay.
And then after a while, urine stops.
Okay.
So now the intake of water reduces. It's like you have to take half a liter of water a day. So that's just the water you take with your medicine, maybe half a cup of tea.
Yeah.
So it was really difficult to ask. And then life just changed. I'm no longer the energetic boy I was. There's a lot of fatigue. You cannot walk into like places you used to, or you cannot eat the things you used to eat. You're constantly tired. Your body's just, you can just feel your body's not okay.
Yeah.
So, and the medication again. You're taking a lot of medication. You're getting, well, your body's reacting to medication. Some cannot be positive. Some medication can be a bit heavy in your body.
Yeah.
So it was a bit tough.
I see.
Now then my life started becoming very expensive.
I see. And we'll talk about the cost as a little bit. Allow me to our doctor chime in into that. It's like a complete, not to say overhaul, but a complete change, of life from diagnosis onwards, and also a progression, because like he said, stage 3, you're told it's stage 3, but in 3 months he had progressed to stage 5. So what is that like? What areas of the progression?
So Tony's story sounds like, he's probably already had chronic kidney disease when he was diagnosed. He was chronic kidney disease stage 3 at that time, and probably it progressed really fast. I don't know the exact, diagnosis, what was there, what was the kidney biopsy. But then it progress if it's, and then he required dialysis. As you see, the kidney function, like normal person, we don't even think about things. Our kidney works 24 hours a day, 7 days a week. And you're trying to replace that function for, twice a week, 4 hours. And that's why Tony still feels tired. He can't do the things he used to. Ideally, you should be getting 3 times a week dialysis for a little more better quality of life. But the best quality of life will come to him when he gets a kidney transplant. So I think, a clear example of how it can progress as well.
I see that. And also for the staging, right? If we can go through them very quickly, because the focus really is on transplant and dialysis.
No problem.
But when you say someone is at stage 3, at stage 5, what exactly do they look like?
We discussed about acute kidney injury, and that recovers. If it doesn't recover for more than 3 months, then you term it as a chronic kidney disease. Chronic kidney disease, as I said, is secondary mainly due to diabetes, high blood pressure, or glomerulonephritis is what Tony had. Tony had glomerulonephritis, and that's what caused his nephritic syndrome. Glomerulonephritis means inflammation inside the kidneys, and that damages the filter I was talking about earlier. So then you go into chronic kidney disease, you progress from stage 1 to stage 5. And we measure, as I said earlier, a blood test called the creatinine. Creatinine is one of the best products of our body, which is, excreted by the kidney. The higher the creatinine, the weaker your kidney functioning is, because you don't get rid of that waste product, so it accumulates in your body. So if you have creatinine of 100, 300, 400, 500, and then with that creatinine, with the age and with the weight, we calculate something called the estimated glomerular filtration rate. Okay, as I said earlier, 180 liters are usually filtered through the kidney. So normal kidney function is more than 90 mils per minute. So every minute, every minute your kidney has to filter that much. And as it goes over, the stages increase. So stage 1 to stage 5. So stage 5, GFR is less than 15 mil per minute. So some people it takes shorter time to progress. Some people takes longer time to progress. We have medicines now to prevent the progression of the disease. So if you see a doctor, he can give you medicine that will prevent. So your blood pressure should be better controlled. Your blood sugar should be better controlled. We have newer medications now which have shown that it prevents progression of kidney disease from, let's say, stage 2 to stage 5. So you have a longer period without dialysis.
I see that. So how long have you been on dialysis?
I started dialysis on 5th September 2023. So now that counts 1 year, 6 months.
All right. So it's a week, every single week?
Yes.
Or are there instances we see like 3 days, or just constant? Twice?
Just twice. This has been working for me.
All right. Have you had conversations about transplant, maybe considering it?
Well, frankly, every patient in renal unit considers transplant.
Yeah.
But the issue usually comes when it matching. You know, you don't just get kidney from anyone. It has to be somebody with your same blood group. And there's the issue with finance.
Okay.
The tests only a fortune. So if you don't even know if you're compatible with somebody, now there's an issue.
You have to do that all over again.
So you need to find a donor, do a test. If you're compatible now you prepare to a transplant, and that needs money again.
More money. So, yeah, do you have, say, a donor? Have you found a donor? Like, how is that for you, the whole process?
I had potential donors, male.
Okay.
Doctors really, they usually advise male donors. I don't know why, but they didn't qualify.
Oh, I'm sorry.
So the only person who was still compatible with my blood group is my sister that's following me.
Okay.
So we are still discussing with doc.
All right.
And then see if she can qualify. If I'll be lucky, and go back to my normal life.
Yes. I see how your face lights when you say, I can go to my normal
Yes, I have to be optimistic. I have to believe it's going to work.
We're believing with you that it's going to work and you get the transplant. But Doc, so dialysis, transplant, do you see more patients on dialysis? And if so, why is that the case?
Yeah. So, when you reach CKD stage 5, you start getting symptoms like Tony had, like nausea, vomiting, accumulation of fluid in your body, then you have to start dialysis. Luckily, we have dialysis, which, makes you live. If you didn't have dialysis, then you would just die because, apart from toxins, things like electrolytes, you eat your bananas, you eat whatever you want. Your body gets rid of the potassiums, the hemostasis controls the sodium. So what happens in kidney patients, again, is the accumulation of things like potassium can, stop your heart, okay? So that's why they're told to have low potassium diet. So then we have dialysis, which helps them survive. Because if there was no dialysis, like if your heart fails, you don't have things to support it, you die, right? Luckily, we have dialysis for kidney transplant as a stopgap measure for patients with kidney failure. Then final stage would be kidney transplant.
All right.
Dialysis means, you just take your blood, clean it up and put it back like real time. Get rid of the toxins, get rid of the extra water, etc. Obviously, currently, we have almost like 6,000 patients on dialysis in this country.
Wow.
Luckily, the government, started the dialysis program. All counties have dialysis, centers. The shift days for the dialysis, so that's great, at least twice a week. Again, as Tony said, the quality of life in dialysis is not good. You have to go to a dialysis center at least 2 or 3 times a week. You're there, bound 4 hours. You can't do anything. Again, it's just the symptoms also are still there. I mean, you don't get rid of symptoms of kidney failure. It just helps you survive, okay? But again, the final quality of life would be better if you get a kidney transplant. Obviously, there are challenges in kidney transplant, as Tony has mentioned. One is getting a donor. There's nothing like we prefer male donors or female donors. Anyone can be a donor. It doesn't matter, male or female. So, anyone can be a donor as long as they're willing and not selling their kidneys. Okay, so the country and the law does not allow you to sell kidneys. And the law, what we still do here is just living-related kidney transplants. Okay, we haven't gone to what the West does is, this is donation. Okay, you get an accident, your kidney is still fitting. It's just, probably your brain injury or something, and your kidney is given to somebody who has kidney failure, your heart given to somebody who has heart failure, your lungs. So all the organs are distributed. Not yet here in the country. What we still do is just link-related. So you have to come with own donor, who is your relative. You're not buying the kidney from. And the first thing is your blood group should match. Okay, so better outcomes when your blood group matches. That's one of the main thing. The blood group matches The second thing, you don't have to have the donor does not have to have diabetes, does not have to have high blood pressure, should be living a healthy lifestyle. Because we don't want to have two patients, right? Because we're going to take one kidney from you, and if you have diabetes or high blood pressure, then your other kidney, now you remain with one, can get affected.
Okay.
We have to screen of all the disease, infections like HIV, diabetes, hypertension, other infections as well. So perfect donor, then we accept you as a donor. And you can live a normal life with one kidney. Some people are born with one kidney and live a normal life. So they don't even know. They don't know they're living with kidneys. So, sometimes you get donors and then we just do an ultrasound and you see it's only one kidney. You can't take that one kidney. So,
it's a lot of tests and processes that was through it. I've had stories of people who say, yes, my family member was actually compatible. But then again, they were scared, as would accept to, go through the process, that is ovulation and transplant. But then again, after a while, pull out. So I'm curious, what are some of these reasons why people, you would say, are scared? You mentioned some are scared to, be like, how will I survive with one kidney? But then what are some of those things that you see?
Sure. I mean, great question. It's a surgery. Everyone's scared of surgeries. It should be an altruistic donation, right? You are donating because you love somebody, not any financial gain, and you're willing to go through that surgery. Every surgery has a risk, right? So, but talk to them, talking to the donors, explaining to them, the risks are just minimal. The benefit probably much better for the patient who's get a kidney. You can live a normal, healthy life after, donating. You can get children. And everything goes back to normal. You just have to come to the hospital, discharged after 3 days. You can start leading your normal life. Once your, wound is healed, that takes around 3 weeks. After 3 weeks, you can get back to your normal lifestyle or life. So explaining to them, talking to them, that helps a lot for them to accept being a donor.
I see. And Tony, you said after your diagnosis, life became expensive. Can we get to understand how is that? I know you've talked about the medication, aspects, again, cost on dialysis. So do you want to break it down for us?
First of all, as I told you, I usually have a lot of fatigue. I can't move around the way I used to. So I hope to use the bikes, cabs, which costs money.
That's expensive.
And when it comes to diet, now I don't just eat anything like the way I used to. Now I'm supposed to like fruits. I don't eat bananas, avocados, and all fruits with high potassium.
All right.
So you opt for other fruits like apples, grapes, pineapples, which we know are not the same as bananas.
That's true.
And then food. Now, as for me, I use a lot of proteins.
Okay.
So I'm supposed to consume food with more proteins, white meat specifically. Ask anybody, eating chicken almost 4 times a week. That is not cheap. Then we come to medication. So, I don't know, with dialysis, most of us, we have issues with our HB, blood goes down. So we usually have to come with the medicine on dialysis, Epofit and Iron Cross, which is still expensive because it costs about 3,000. So imagine that every session. And it's just a Gen Z who pays for his bills. That is tough. And that is just the medication you do, and there is the monthly. Then I take every day. And because me, I deal with my hypertension, so I take a lot of antihypertensives. They work together to at least balance my BPs, because, it can continue damaging other parts of me, and that. So majorly medication is expensive.
So then, How are you managing? Are there, say, sacrifices that you've had to make? Are there compromises that you've had to make just to ensure that you're okay, in as much as, you know, so much that, I mean, you could better, right?
Compromises I've made. Well, it made me lose my friends, couldn't go to... Well, I'm a graphic designer.
Okay.
So it actually restrains me from traveling.
Okay.
And where I work requires me to travel, even outside the country. But I'm supposed to be here on Monday and Thursday. Imagine that opportunity. I can't get that.
Yeah.
And even going for an interview, and they know, like, you are a renal patient, you are not going to be here on certain days, or maybe, you know, sometimes you don't wake up well.
Sure.
So when you wake up, you feel you're okay, you just thank God.
Yeah.
But because you don't get that every day. And then dialysis too. Dialysis sometimes used to affect me somehow. But now I'm used to it.
Okay.
But not everybody's used to it. Some people react differently to dialysis.
Okay.
Yeah, and well, there's this time we went this Chief and Sha. See, there's time we had issues with the government paying, and it stopped.
Yeah.
Hospitals stopped giving services to dialysis with the
For dialysis patients, yeah.
You can imagine, you can't miss dialysis. Your body asks for it. You cannot miss dialysis. So you can imagine, in that day you're told you cannot use the SHA. Now you have to pay almost 12,000. Yeah. Where do you just have 12,000 in your pocket just like that?
Yeah.
There are some people paying cash every time, actually.
Yeah.
So it's really difficult.
It's really much. So then approaching it holistically, because, you know, when we talk about cost, not just the cost of treatment or cost of transplant or dialysis, a lot like a whole, right? So then how do we get it right? What do we do that to help as many patients? Because we've so many patients also stay on dialysis for a long time because they cannot afford to pay for transplant. How to get there as a country? I know this is like
a tricky question.
Yeah.
So I think what we have to do is I'll go back to what the theme is for this World Kidney Day, World Kidney Week, is prevention. Okay, you have to prevent kidney disease, and I said earlier, a lifestyle disease. Okay, because the most common cause of kidney failure is diabetes, right?
Yes.
And diabetes is a lifestyle disease.
Yeah.
So diabetes, high blood pressure are still the most common cause. Tony's disease is a little, not so common, like causing kidney disease, like diabetes. Diabetes still remains number one. So healthy lifestyle, okay, which prevents, the exercise, what you eat, okay, obesity, avoid obesity.
Yeah.
So, you prevent you to get diabetes, prevent you to get high blood pressure, and prevent you to get kidney failure. So we should start there.
Okay.
Primary care, prevention. If you're diagnosed early, screening, diagnosed early, prevent those patients to reach, dialysis, okay? And that will help us, the economies of scale. You might spend a little money in prevention and diagnosis early and lifestyle, but it will prevent you spending money on dialysis, okay? For me, it doesn't make sense. You're spending so much money on dialysis, but you don't want to spend money on prevention and early detection, right? So you spend so much money there, and then, so I think number one, lifestyle focus, prevention focus. Then when it comes to dialysis, Chief pays twice a week dialysis, so at least that what government supports. It also supports the kidney transplant program, part of the cost of the transplant as well. So I think on that side, the NHIF or Chief is doing some good work. That's what I think.
Right. So then, Tony, what will his take for you? Because remember you said, the cost aspect, when it comes to transplant. Donor, but are you still yet to do like a compatibility test with your sister to see if she's like a perfect match to you? But other than that, if something was to work out for you, what exactly will it be for you to get the transplant? Because you have potential, we can call her the donor, but what is it that you need now for you to get transplant?
It's the same thing, France. I need money. When you get money, you get at least you can do the test, and then we can know if compatible. If it's compatible, I'm sure. Now, we can now start considering doing the transplant, and you can now start looking for money. But without the compatibility test done, nobody can bring money because
you don't know.
You don't
know. Yeah.
And then there's an issue. A lot of people actually don't understand this issue with the donation of kidney.
All right.
You tell somebody about kidney donation things, maybe they're going to be sick like me. And there's an instant I told somebody about my kidney saying, I have children to take care of.
Oh,
they don't know. A lot of people don't.
Lack of awareness.
So I really think people should be educated. People don't know about chronic kidney disease a lot.
Yeah.
Even at home, some people don't know what I'm ailing from.
Yeah.
Just to know Tony is sick.
Yeah. So there's a big gap when it comes to awareness, So
you can imagine, they even don't know what I'm ailing from. How can they help me?
Yeah. And with a donation. So clearly, there's some gaps here and there, but I'm also curious, are there programs that maybe
there's lots of advocacy, educational programs, a lot of NGOs, the Kenya Renal Association. We hold educational, camps, each hospital during this part of World Kidney Week. There's lots of screening, screening happening. Most of the hospitals around the country, lots of education happening around the country. We have something we do in this hospital, which is something interesting, is we have what we call kidney transplant games.
Okay.
And that happens towards the end of the week, kidney week, so this Saturday, where we get patients who are on dialysis, who their families, patients who got kidney transplants come together, doctors, nurses, and we have good time together playing some games, showing that when you get a kidney transplant, you can go back to a normal life, do normal exercise, have fun, and everyone. It's a way we can educate the public. Well, what you're doing here is great as well. All this is education public about kidney disease.
Yeah, I see. So then, Tony, as we bring this close, and being and going through this journey, and even as you hope and live to to get to that level of transplant soon. So what is it that you'd like the people to know? And this cuts across the population to healthcare providers to governments. Well, because like you said, this is not. No condition is easy. A condition is cheap. But you've gone through this, and this as far as chronic kidney disease is concerned. What is it that you'd like people to know?
First, I'd like people to know that the hospitals are not only for sick people. You can go when you're healthy. Doc said the constant migraines.
Yes.
Don't assume that. Go to hospital and get checked.
Yeah.
And I really urge the government to educate, especially on high school, primary, because that is when things actually start. Something I came to understand later on that some symptoms I had with knowing what I know now.
Yeah.
I would have gone to hospital
sooner.
But IBPs, you go to hospital, you have to go to trial before you say that your BPs are high, but maybe you're young, maybe you're just active.
Yes.
They ignore that. And then there's a thing for me, for my case.
Yeah.
There's really this, when you wear socks, and then they mark like You see, like, that's like you're holding fluids. That is something I think if I took it serious back then, I would have been in a different place.
Yeah.
People should go for screening a lot. And people really need to learn about all this. And the government, I really am hoping they can put more funds on these cases because it's really hard to manage on your own. Look, like me, I'm just me, 24, and I have to pay for all my bills. Have to pay for, I'm lucky Sha is there for the dialysis. But what about the rest of the things? Now I can't even get employment in places and to be because of the issue. So I really had the government to put more campaigns on chronic diseases and put it maybe in high schools and primary schools. They should like really teach people. People need to understand. Because with the knowledge, now they'll be able to know the symptoms earlier.
Or even prevent, like Doc said, you know, focus more on prevention.
And lifestyle.
I see.
You know, now everybody's working hard to get money and go and eat a lot of junk food and everything.
Focus on lifestyle as well.
Yeah, lifestyle.
All right. Thanks, Tony.
And drink a lot of water.
Yes. You know, you mentioned, Ellen said, the luxury of drinking water that sometimes take for granted.
We can't drink water like you guys.
I see.
If so by any chance I do a transplant, I'll be carrying a water bottle everywhere.
The 2-liter one. Thank you so much, Tony. And Dr. Arias, will bring this to a close. Really, in terms of awareness, yes, what needs to be done. So that a few years from now, we have totally different conversation on chronic diseases, but really since focusing on chronic kidney disease today, and especially for transplant and on dialysis. What would you say?
Yeah, I think we're moving in the right direction. Lots of improvement, 10 years, in last 10 years, and now there's more patients in dialysis. Now we have to go a little step higher and start what we call the disease donor program, get more donors and improve our transplant numbers, because, the dialysis units are now almost full with dialysis patients. There's no exit route because of lack of donors, lack of finance. So I think what Tony has said, government should focus on those things to improve kidney care. And again, we started earlier talking about screening, lifestyle, appropriate medical care, quality labs, etc. That will go a long way in preventing and preventing progression of kidney disease.
I like that. Thank you so much for this time. Unfortunately, we have to put a pause, but again, we'll dedicate this entire month to really talk about kidney disease and kidney health, because a lot of people don't know, and there's a lot of mis and disinformation out there. So clearly there's a gap that we need to really focus on this conversation. But for now, we say thank you for your time. Tony, thank you so much for sharing your story with us and your journey. And together with you, we hope and we believe you will get transplant very, very soon, so you can go back, like you said, to normal life, because when there's so much that you can do. So all the very best with that. And that is Tony Tai, who is a dialysis patient. And a special thank you to you, Dr. Professor Ahmed Sokola, who's a consultant nephrologist at Aga Khan University Hospital right here in Nairobi. But also a very special thanks to the Aga University, and specifically on Center of Innovation and Medical Education, for hosting us today. My name is Lubembe. A lot of introspection that we need today on kidney disease, really, and kidney health, but also the conversation that we started on earlier, that is on neglected tropical disease. So think about those, have conversations with your friends, with your loved one. That's together we can help create more awareness on kidney health and neglected tropical disease. So have yourselves a lovely day ahead. I'll see you tomorrow morning, same time, same right here on Your World on Trendy Thursday. You do not want to miss the conversation tomorrow, but for now, enjoy the rest of your day. Goodbye.